So in previous class, we completed about vitamins. Today we will discuss about minerals. Okay, like carbohydrates, like protein, like fats, like vitamins. Minerals also very important for our body. Okay, very important for our body. Okay, so they are present in body fluids. Okay, body's tissues, cells. Okay, and will play very crucial role. Very crucial role. Okay. These elements are present in salts, sodium chloride, calcium phosphate, ferrous sulfate. All these are minerals. Okay. So basically, we have more than 50 types of minerals. How much amount? More than 50 types of minerals. Okay. In that, 24 are very important. 24 are very important for our body. Okay. Like carbohydrates have function, protein have their function, fats have their function. Vitamins are not produce energy. Okay, likewise, minerals doesn't produce energy. Okay, it will contribute like a mediator in our body. Okay, so they are required in small amounts. They are required in small amount. Okay, so it will also we will consume by food only. It is not available internally. Our body can't produce these minerals, so we have to take the required amount, and body will absorb it, and the function will happen, and it is released from the kidney, stools, or bowels, or skin. Okay, from the urine, stool, and skin. If extra amount is okay, extra amount is there. So this is very important. Okay, so like we have calcium. You can see that calcium is also a mineral, but it is inorganic. Okay, and where it required for bones, it required for teeth. Okay, so this is very important. Okay, this is the introduction part of minerals. So we have three types of minerals. Again, minerals are divided into three divisions. How many types? Three divisions are there. One is major minerals, minor minerals, and we have trace minerals or trace elements also. We can call elements also. But minerals is a good term to explore that. And major also known as macro, minor also known as micro. Okay, and trace is also important. So we'll discuss all this in detail. Okay, first, what are the minerals are present in micro? In micro, we have calcium. In micro, we have phosphorus, sodium, chloride, magnesium, and sulfur. In minor, we have iron. In minor, we have micro, we have manganese. Okay, this is very important. In trace element, we have zinc, we have iodine, we have fluorine. Okay, so these are the important things we'll discuss in detail. Let's start with what are now the general function of each, not all the minerals. What are the general function? What first is structural components? structural components means to give the structure, like we need calcium for bones, we need calcium for teeth. Okay, calcium is necessary not only for bones and teeth, it required for nerves, it required for muscles. Okay, what it given? It gives structural components. Structural components is required for strength, for support. Okay, if there is loss of calcium, what will happen? The bone will weak. If the bone is weak, the strength is lost. Okay, nerve and muscle function, not only structural components give function. Okay, so function to proper function, we need minerals, nerve function. Next is acid base balance. Acid base balance. So general uh, pH level is 7.4. Okay, sodium and chlorine will help to maintain the pH level in the body. Okay, so if the as body will go acidic nature, which is also harmful. If it go alkaline nature, it is also very harmful. Okay, so it maintain acid base balance. It is water balance, like sodium and potassium. Okay, role in molecules also, molecule function, like uh, our hormone, thyroid hormone, need iodine to produce thyroxine or thyroid hormone. And for insulin production, we need zinc element. Okay, so very important to produce an a hormone molecular function. The iodine is needed to produce the insulin. Zinc is needed. So that is very important. Next is enzyme activation. Okay, enzyme activation. So I already told you that mediator, cellular oxidation. Okay, next is blood clotting. Very important function, blood clotting. Okay, so these are the functions of minerals, general functions of minerals. So first we will study about macro minerals. First is calcium. So calcium is also is written in Ca. It is the short form. First letter is capital, second is small. Okay. In our body, most abundant mineral, most abundant mineral, and it is produced in large quantity. So our if your body is weights, your body required 1.5 to 2% of your body weight, means that much we required. If it is 100 kgs, mean you need 2 kgs of calcium in our body to proper function. Okay, so it is present in mostly in bones and teeth. Okay, 98% is present in, and 1% is in 98%, 2% in soft tissues or tissues, other tissues. Okay, so what is the function? Functions of calcium, very important for formation of bone and teeth. Okay, next, blood clotting. It is a factor, one of the factor we need for blood clotting. And capillary permeability. Capillary permeability means blood exchange, tissue exchange. Capillary, when blood in the blood, we need some. We have some oxygen level. We have sodium, potassium, anything. Calcium is required to exchanging of those things in good manner. That is called capillary permeability. What is called capillary permeability. Very important. And not only this, nerve and muscle function. So we have pulse in the veins. We have pulse. Okay, nerve. The pulses required to jump. So we need calcium to require the energy transformation. Okay. Likewise, again in the muscles also we need calcium. Okay. For muscle contraction, we need calcium. For nerve signaling, we need calcium. So very important. And last function is for lactation also we need calcium. Essential for milk production in lactating females. So milk production we need calcium. So very, very important function of calcium. So it is very essential mineral in our body. Okay, without calcium, you cannot imagine our body will work. So there is a reason nowadays every doctor advised to check up their calcium levels. Okay, absorption for absorption you need calcium. Sorry, vitamin. Okay, in the presence of vitamin D only, calcium will absorb. So if there is required amount is decreased, means there is vitamin D deficiency is there. Okay. So this is very important. Now sources, how we will get this? First is milk. You remember one thing. I have simple idea to found the calcium. What is whichever is white color food, they have calcium. This is the single thing I will advise. So whatever white thing, there is calcium is present. Like eggs. Other than that, also present, but you can imagine this all. We have dairy product, all dairy product. Next is eggs, okay, fish, greeny, leafy vegetables, cereals, okay, millets, and some fruits like custard apple. That is also white in color. It is will be able in present in so mostly winter season. In the there is a different range, okay, like in the cow mills, we'll get 100 mg per liter in the cow's milk. Now we'll go to the required amount, RDA. Adults need 600 mg per day, adults. And the pregnant lactating women lactating means 1200 mg per day. Infants need 500 mg per day. Children below 10 years need 600 mg per day. And about 10 to 15 years need 800 mg per day. Okay, after 15 years need 800 mg. Again, means 10 to uh, 30 years mostly you need 800 mg. So basically, this is the required amount RDA. What will happen if there is deficiency? Deficiency leads to in children's like rickets, okay, osteomyelitis. This is one of the disease. Bow leg or like leg, you can see that, and osteoporosis. Okay, it is due to the calcium deficiency. And in the mostly menopausal Women, they will have osteoporosis, so they need to take more calcium. Okay, you have to increase vitamin, not only calcium, you need to increase vitamin D also in the body. Okay, now the second important calcium, macro calcium, is phosphorus. Phosphorus is very important. It is also for teeth and bone. Calcium and phosphorus both are required, and also for cell respiration, cell metabolism, and various physiological process in the body. Okay, it is present in both organic and inorganic form. Very important for DNA, RNA, ATP synthesis, lipid metabolism, and acid-base balance. Okay, how much amount we required? 400 to 700 grams per, okay, as phosphate. Means in the body. Okay, like 1 to 2 kgs are present calcium according to 100 kgs. Like 400 to 700 grams need approximately in our body to maintain all the functions properly. Okay, so DNA and RNA, phospholipid, okay, covering of all the cells, ATP and ADP, coenzyme, okay, cell membrane structure also I told you. So buffer system, and it is also maintain acid base balance. Okay, so this is very important. So how much amount you need daily? 700 milligram, not 700 milligrams per day for all the persons, mostly 700 to 800 milligrams per day. You need daily amount is that. What are the sources we have? It is present in milk, it is present in meat, it is present in eggs, fish, whole grains, and cereals, pulse, nuts, oil seed, all are the sources of phosphorus. Basically, a small intestine absorb the phosphorus. Okay, what will happen after that? It will, if a normal amount is utilized, extra amount is stored. Okay, if extra amount will occur, what will happen? Body will release from the uh, body, from the urine, stool, in skin, through skin also. Okay, what will happen if the deficiency occurs? Okay, but it is very rare. Phosphorus deficiency is very rare because we usually whatever we take the food, phosphorus is present. So that's the reason. Like all the uh, cereals, pulse, nuts, oil seeds, grains, we will take daily basis on that. So that's the reason phosphorus deficiency is very rare. But the calcium deficiency, you can see. Okay. Same symptoms will occur, whatever if the deficiency occurs, calcium deficiency, phosphorus deficiency are both same. So this is the second important mineral. Next is manganese, magnesium. Okay. Magnesium is also very important for bones, soft tissue, okay, and cells, mostly all cells. But it is required in small amount, less than calcium, less than phosphorus. Okay. So this is very important. So in total body, we need 25 grams of magnesium. Okay, roughly will present in this bone, all this in the soft tissues, etc. What is the function? So already told you that for we need for bone, soft tissues, and as well as for enzymes production, And sometimes we need for regulation of nerve impulse, muscle contraction, and for relaxation also. Muscle relaxation is also a function. Okay. Calcium, sodium, potassium for conjuncted them. Okay. So magnesium will work to bind them also. So typical amount we needed 300 to 400 milligram per day. Okay. So we will get from all the food having magnesium like cereal, bajra, barley, wheat, soya beans, gram, okay, leafy vegetables, all the fruits, eggs, meat, fish, everything have those food. So that's the reason we'll get easily magnesium and phosphorus. What will happen if magnesium deficiency will occur? So whoever take alcohol, who will take alcohol, it is very important because alcohol will decrease the absorption of magnesium. So that's the reason malabsorption syndrome will occur. What is the symptoms like depression, muscle weakness, irritability, tremors, vertigo, delirium, okay, and convulsions like symptoms like fits and other symptoms also will able to discover. It will happen if you take high amount of magnesium. So you will get extreme thirst and you will get excessive warmness, drowsiness, numbness sometimes. After taking magnesium, doctors will will advise to take calcium gluconate. Calcium gluconate will correct your magnesium levels. Okay, so this is very important. Magnesium first is calcium, second phosphorus, third is magnesium. Next important is sodium chloride. Sodium chloride. Okay. Sodium chloride is also known as table salt, what we will call in daily life salt, table salt. Very important. After calcium, sodium chloride is very important. Sodium is need for extracellular fluids and play an vital roles in maintaining fluid balance. If you want to maintain your body in fluid, what you need sodium. Nerve function, it will do? It will do uh, fluid balance. Okay, you need for uh, nerve function, you need for muscle contraction because what will do? It will do cellular. We have cellular uh, negative energy. What will provide positive energy, potential. Okay, potential energy. Okay, so this is very important for nerves. So if your sodium correction will do in the hospitals, they will give the sodium chloride injections, bottles, NaCl. Okay. Uh, Mostly, some people have sodium uh, decreased level in the body. Okay. So what are the sources? Sources you will get all the nature food. Every natural food has sodium. Milk, even milk, eggs, meat, poultry, green leafy vegetables, legumes, beetroot, nuts, resins, we'll call kishmish, coffee, and tea. Okay, some additives we'll take in the packed foods. Then in that also you will get sodium, a large amount of sodium. Okay, so this is very important. So you need mostly 15 to 20 grams for adults, In children, 5 to 10 grams. 5 to 10 grams. Okay. Children's 5 to 10 grams. Adults 15 to 20 grams. Okay. And pregnancy 10 grams. Lactation 15 grams. Heavy works need 20 to 25 grams. Like in summer season, we'll have more thirst. We will have more uh, sweating. So at that time, we need sodium chloride. Deficiency, what will have, some persons will have deficiency, like physical, whoever do physical activities, who have more sweating, farmers, mine workers, athletics, okay, whoever have severe vomiting, diarrhea, sodium will release from the body. Okay, they will have muscle weakness, some BP will down, muscle cramps, low BP. So what will happen? We have to give the sodium to increase the level. What will happen if excessive level is there? You will get edema because fluid balancing is sodium done. So you will get edema and high BP. What will happen? High BP and edema. So what will happen? You have to decrease the intake of sodium. So 15 to 20 grams to reduce to 10 grams. Okay. So this is the function of sodium. Next important uh, element is this potassium. Potassium is also very, very important for acid base balance. Next thing, to maintain the pressure, osmotic pressure, nerve impulse, muscle contraction. So all these are very important. All these, all the functions are same. Osmotic. That's the reason whenever you go to the hospital, admit in the hospital, they will check the sodium, potassium, chloride levels. This is called electrolytes. We'll call electrolytes. They are combined called electrolytes. So nerve impulse and muscle contraction. So potassium present in every food. Cereals, grains, green leafy vegetables, lentils, spinach, dry peas, carrots, radish, sweet potato, raisins, almonds, peanuts, and sea coconut. Coffee, tea, and cocoa also rich source of potassium. If deficiency occurs, what will happen? Mostly potassium deficiency, very rare. Not only rare, if the deficiency occur, okay. Uh, like mostly in clinical conditions like chronic alcoholism, any surgery, or you are in the medications like diuretic, okay, you will have weakness, muscular cramps. These are the symptoms of uh, potassium. Okay, so this is, we completed the macro minerals. Okay, so we have two types of other remain, that is minor minerals and trace minerals. In the minor minerals, we'll talk iron and magnesium. Another is also is the sulfur. We'll discuss tomorrow. Same function. It is also present in everything, every food. Most of the food having all these minerals. Okay. So this is about minerals, macro minerals or major minerals. Tomorrow we'll discuss minor minerals and trace minerals. Anyone have any doubts? Kindly.